North Pole. Okay. Questions, I guess. John, you're first.
Does Medicaid cover too many providers now in terms of the various specialties? We go beyond the minimum, as I understand it, that the federal government requires to dentistry, podiatry, whatever. Do we need to cut back the number of services?
I think that's something that we'll have to take a look at, and you have to look at what value is being provided by those providers and what services, what needs are out there. Sometimes what it might look like that there's too many providers, but really it's not, because there is a specific need that needs to be filled. Now sometimes what you can do through the Medicaid program is narrow who receives the services, but you have to be very careful about making sure that the services that are needed are accessible.
And what was your experience in DC? Did you cut the number of specialties covered, for example?
No, we didn't. One of the things that Mayor Fenty wanted to do was, he said to us, maintain the same number of people covered and the same benefits. And so what we looked at is reforms in other ways. Payment system was a big way of us looking at reforms and making cuts. And so that was the areas that we looked at.
Greg, you want to comment on this?
Well, I think John said it. It's about value, and I think we need to do more to look at price and quality and make that as transparent as we can. Because beyond just Medicaid, eventually where we're headed is, as a health system, being able to look at where value is and purchase that. And with the money we spend on healthcare, to choose what we want to pay for, instead of just paying for more, because the current system is driven a lot by volume, to drive quality by paying for what we want, which is value. But there are steps along the way to get there. Medicaid is a big tool in the process, but it extends beyond Medicaid too.
Governor, when you talk about freedom and choice for seniors, does that include passport and long-term care? Do you see other alternatives?
Look, we know there's going to be a big change in long-term care. I mean, there's not been a secret here in any way, shape, or form. And what we find is that in that area, there will be some who are purely in the nursing home business who will benefit from our program, and some who will not. And but you have to sort all this out. And in terms of what John McCarthy just said in answer to John here, look, we can't tell you at this point, or we're not prepared to tell you whether there's going to be limited services or whatever. We have a big problem in this state. We're very sensitive to the need to balance our problem with the need to deliver services. Now, look, we want our seniors to be in as comfortable a setting and as an independent a setting as possible, and also where it's something that it ultimately benefits the taxpayer. I had a mother-in-law that died in last January, and I mean, she wanted to be at home. She didn't want to be in any kind of a setting that was not her home. And we should make it very easy for people to be able to have this kind of independence. And then you have the whole range of facilities. If you look up at HCR Manor Care, they go from A to Z in terms of, that company, because it's a Toledo company. Get people where they are most comfortable. And I think that's going to be a hallmark of what you will see us doing going forward. You want to make a comment on this, Bonnie?
Thank you, and it's also a great question. And the governor is absolutely right about people want to be able to be home. But one of the things that is going to be a priority for us is not just to look at the locus of care, whether it is the kinds of communities we're talking about or an individual's home, but also what goes on in each of those settings. Because our goal is that every senior or everyone who needs care is home wherever they are getting the service. So that just because you are being cared for in a large organization, it does not need to be an institution. We can deliver, it can be the individual's home by the kind of care we deliver. And that has been a long-standing goal of the Department of Aging, and one we will continue, and one we will be learning from and working with our colleagues in developmental disabilities and throughout the care continuum because there are some wonderful leaders and some best practices for us to think about.
Greg, any comment? Okay. Good.
I had a question for either Greg or John. Do you think that Ohio Medicaid can save big bucks by emphasizing outcomes and payment reform alone, or will there have to be changes, cuts in optional services and/or eligibility?
You know, for this budget, which is unique, it's going to be all hands on deck, all policies on deck. I think in terms of understanding what the potential is to generate the best quality of service for folks in a way that is most efficient for taxpayers. It is not going to be a single area. You know, cutting a rate here is not going to balance the budget using Medicaid. It's going to be a combination of policy changes that interact in really complex ways that we're going to try to figure out in the next 90 days, and then through the course of the budget process to make sure by June we have a package that works together. I would encourage you to all think that everything is on the table, because the discussion will be richer if the things that need to be protected are being debated for their value. But at the end of the process, we are hoping to get as far as we can through the policy change. You don't want to default to decisions just because you have a gap to close. You want to close the gap through choices. But this budget is very difficult. And at the end of that process, there may still be some of those difficult choices. So that's why communication through the process, being able to understand the value of how everything fits together, is going to be a very important conversation. This team and all the directors, our purpose is to create an environment to make the quality of that conversation as good as we can get it. And I have a feeling, I mean, I'm looking out here, I see a lot of friends here today. And I really have a feeling.
You've got a lot more right now.
Got more. Got you.
We'll see how many Christmas parties you get invited to the day you leave this job. Okay.
But the viewpoint has changed. You know, the things we've been talking about, you know, among ourselves over the past couple of months is very different than what we have ever talked about before. So not only are we ready, but I really have a sense that folks are in a different place. Folks understand the gravity, and I think see the opportunity. You know, we have a window here that does not last forever. New leadership, budget crisis, some interesting things from the federal government. Those things don't last much more than the next 6 months to really act now for what comes next.
You know, and it includes things like potential changes in the dual eligibles, which is something the administration has indicated some flexibility. Greater use of coordinated care as it relates to prescription drugs. I mean, there's a whole series of things that, first of all, make sense and have been put off. And to some degree, as I stand here and listen, if I were a reporter, I would think that there was a lot of code being spoken here today, because there's not so much of the specifics, Laura, but what they're trying to do is to re-engineer the whole system. That's what this is really about, to break down silos, to force coordination, and to not let interest groups come in and pick the decision makers off one at a time to drive what is an uncoordinated solution. So we do have the potential here to have a really terrific transformation in the way this entire system works. And you'll get all the details, and you know, there are going to be a lot of people going to be very concerned and upset and everything else, but there'll be a lot of people that I think will be very pleased with where we end up. And the other thing is fair, right? I mean, fair. Nobody gets a deal because they worked in the state senate with John Kasich 100 years ago. I mean, the one thing I try to tell everybody is fair. You get a hearing, we make a decision. And you know, you might not like the decision, but as long as you're not being ripped off in the decision-making process, people can live with it. That's been my experience.
Can you talk about the statement you made about the role of healthcare as an economic driver, and specifically how state budget cuts might hurt some communities that are reliant on Medicaid, for example, for a hospital that's very successful?
Well, look, first of all, let's face facts. I've been saying for a long time, we have more heart hospitals in Central Ohio than we have hearts, okay? We have had a proliferation of healthcare, and communities think that the way to economic development is to just build a hospital. I mean, you drive all over Ohio, which I've done, and everywhere you go, the biggest and newest and best building is a hospital or a medical facility, okay? And it's necessary for people, but a lot of people view that as the key to economic growth, okay? In some ways, it's just a transfer of resources. It's not generating wealth. Now, in terms of hospitals, look, everybody understands the situation. We're going to talk to the Hospital Association. Dave Blum up at Ohio Health's got all these, he claims, great ideas, which I've known Dave a long time. He's a good man. I'm sure he does. And we're going to talk to him. And we will try to make this change as, I guess, as I don't say the word easy, but we want to make this change something where they can deal with it. But let me just say to you, how could we have a system where Medicare says if you bungle the patient, discharge them, and put them back in, we're not going to pay you, but Medicaid is? I mean, you explain that to me. I can't. If you screw something up, you can't get paid for fixing it. Get it right the first time. More transparency. We want to know what works. Why do you stick somebody in an MRI when you really ought to have them in a CAT scan? I mean, there's just a whole series of things that we have to look at so you can't afford it anymore. And so that's what this team is going to do. And I'm not a health expert here. I have a lot of interest in it, but it is extremely complicated, which is why we have all of these people standing up here, because it's all part of putting this together in a seamless way. Look, we all plugged together. We know what the realities are. We'll get through this. Now, from an economic point of view, look, I think first of all, I was very pleased to see that the House Republicans actually introduced a plan on health care reform that made a lot of sense, as opposed to Obamacare, which, by the way, will impose enormous costs on us if it ends up happening. But the Republicans had a program. You know, my opinion, you should have had a program when they were in the majority before, and they didn't, okay? But Boehner's learned, and now we have a program. Boehner wasn't in charge then, but now we have a program. I've always believed that the business community, which is now, it's amazing to me how long it's taken them to wake up. They are aggressively trying to manage their employee population. If your healthcare costs are growing at some enormous number, it comes right from the bottom line, which makes us less competitive in a global economy. You know, I was just up with the big three yesterday, which hopefully I'll have one word to say about that experience up there. But if you can drive, you're never going to drive these costs, never going to drive them down? Probably not. Moderate the increases, probably. If you can do that, and you can provide a better bottom line, and you've created a system inside of your state that does it, employers will look at that, and they'll say, hey, that's working, that's great, because our bottom line is healthier. And so, and look, the things that we all know. Exercise, quit smoking. I mean, the idea that we don't have incentives for people to quit smoking. My wife, tremendously interested in the issue of obesity. But word about seniors. I hang out at the World Gym. They changed the name, I guess, but they now have programs in there for our seniors. And I've watched this over time. They come in, they can barely move, and by the time they've exercised for a while, I don't like it, they're doing better than I'm doing on the machines, okay? What I'm saying is it's a whole approach to the way we do health, a whole approach on reimbursement. This guy makes no money. He's a doctor. He doesn't make any money in that job. But yet, if you're a specialist, you make a lot of money. If you're a primary care preventive person, you don't. I mean, talk about doing things backwards. I almost said it, but I'm governor now, and I can't say what's on my mind. So, what I'm suggesting is this idea that we have an opportunity in Ohio to make this whole system work better. It gets me really pumped up, and that's what this team is committed to. And we've never had all this together before. We've never. Think about trying to manage a Medicaid program when you have 5 or 6 different entities of the government trying to run it. Just the way government would invent something. So I think we're on the right track.